All right, we might get started. Hi everyone, and welcome to today's webinar. I'm Jess, I'm with the ACFID Learning Team, and I'm joined today by Tony and Jade from DFAT. They'll be our presenters for today. We're speaking to you today from ACFID House in Canberra, which is Ngunnawal country. And I acknowledge the Ngunnawal people, the traditional custodians of the land where I live and work. I pay my respects to Ngunnawal elders past and present, and to the First Nations people of this country who've occupied and cared for this continent continuously for over 65,000 years. NAIDOC Week begins this Sunday, and the theme this year is Always Was, Always Will Be. And I want to take this opportunity to echo that statement and to acknowledge that sovereignty was never ceded and treaties have never been signed. Before I hand over to Tony and Jade for today's webinar, I'll quickly note our Zoom housekeeping. You are muted in this session, so please use the Q&A box to submit your questions. Also, please take a moment to locate and open the 4 DFAT documents that will be referenced during this webinar. You can find them on the DFAT website, or you can just search for them online based on the titles that we have listed on our housekeeping slide. And that's all of our housekeeping for today. So without any further ado, I'll hand over to Tony and Jade.
Thanks, Jess. Hi, my name's Tony. So I'm from the Child Protection Compliance section of DFAT. I just want to thank Jess for that acknowledgement of country as well. I have Jade here as well with me, who works in our team too. So she's here for to support through the webinar as well. So first of all, I just want you to make sure also you have cups of tea or a glass of water handy too, to see you through. But of course, you are welcome to go and have breaks whenever you like, obviously. So I've been with DFAT Child Protection Compliance Team for about 5 years now. And within my role, have done a lot of training and information sessions with people. But today we're not focusing, and I've had a major focus on child protection, but now we obviously now look at preventing sexual exploitation, abuse and harassment of adults as well. And so we'll be talking about both of those policies today. Just a little message about self-care. For many people, talking about sexual exploitation, abuse and harassment or child protection issues can be sensitive, and you may find this topic confronting or disturbing. If at any time you wish to leave the discussion, please feel free to do so, and you can return to it later via the YouTube session. And please, if you need to, please go and seek some support. And there's some suggested support options there on the slide as well. So what are we going to cover today? First of all, we wanted this to be as interactive as possible. I know it can be a bit difficult with webinars, but please ask any questions at any time, or not just questions, to provide comments and suggestions about what perhaps you're doing at the moment during these sort of difficult times, I guess, in ways that you're managing risk of child protection and SEAH. And I will stop a few times during the session to sort of make sure we get a chance to cover, to discuss whatever you've put down or to answer any questions. But mostly what I'm going to be covering today is having a brief overview of DFAT's preventing sexual exploitation, abuse and harassment policies and child protection policy, and why they are important. We will be having a look at what an overview of these and your responsibilities and obligations, I guess, is really underneath them. And then we're going to talk a bit about child protection and SEAH risk management during COVID, and some perhaps tools or ways that perhaps you can do that and do it well during these times. And then we'll also talk about the DFAT Safeguards Review, because we're currently undertaking a review of our policies, and we'll talk about that too. So firstly, let's have a quick look at the DFAT SEAH policy, is what is how I shorten that. It was released in April 2019. It applies to all DFAT partners, and all their downstream partners. So, and it's not just funded, it's unfunded as well. So if you have if you're a partner with DFAT, but there's no funds involved, the SEAH policy still applies to you. Why do we have the SEAH policy and the child protection policy in place? Obviously, child abuse and sexual exploitation, abuse and harassment of adults and children happens, and it happens in the aid sector, as we can see by these news articles. And it can have a very damaging effect on the children and adults, the survivors, as well as damage to your organisation's reputation. So it's really important that we have in place safeguards to try and minimise, stop this from happening and minimise the impact as well. Just looking at implementation and date of effect of the SEAH policy. It's important to note for DFAT's implementing partners and contractors that the compliance period for all DFAT partners ended at the start of October. So that means that at the moment right now, all of DFAT implementing partners should be fully compliant with the SEAH policy. And then you'll also notice there that the downstream partners' date of effect is 10th of December. The date of effect is 10th of December 2019, and compliance will then be the 10th of December 2020, which is coming up. So it's important that you're all thinking now about how hopefully your downstream partners have SEAH safeguards in place, but if not, we need to start thinking about making sure that they are in place soon. So just quickly, SEAH policy principles, we've got 6 of them. Zero tolerance of inaction, I'll talk a bit more about. Strong leadership is really important. Victim survivor needs need to be prioritised, which I'll talk a bit more about shortly. It's a shared responsibility. That means it's everyone plays a part, everyone needs to play a part in order to reduce the risk of SEAH occurring. Gender inequality and other power imbalances need to be addressed, and we know that where there's more gender equality, there's less incidence of SEAH. And stronger reporting will enhance accountability and transparency, and we need to ensure that people are where it's safe to do so, and in the survivor's wishes, we need to ensure that reporting is undertaken as well. So just quickly on zero tolerance of inaction. What do we mean by that? Basically, we mean that sexual exploitation, abuse and harassment is never acceptable. But we know that zero tolerance is not the same as zero incidence. So we understand it's a long-term endeavour. And we also understand that reports of incidents may increase as improvements to safeguards in organisations occur. So we understand there could be an increase, but what we have a zero intolerance to is inaction. So we're saying that every allegation needs to be acted on in a fair and reasonable way. And that's what we're talking about with zero tolerance of inaction in DFAT's policies. Victim survivor needs must be prioritised. So in this regard, all SEAH reports should be underpinned by a do no harm approach, and we must always prioritise the needs and the rights and the wishes of the victim and survivor, while again ensuring procedural fairness of all parties. So we need to ensure that the victim or survivor is treated with dignity and respect and is involved in decision making and is protected as well. Their privacy and confidentiality is protected. So a quick review of the child protection policy, DFAT's child protection policy. We have 5 principles, which all of our partners, we ask all of our partners to adhere to and to follow as well, and our staff as well. So it's not just our partners, of course, but everyone involved with DFAT, we want them to uphold these policy principles. They're fairly similar to the SEAH ones, and one of the obviously big differences is recognising the best interest of the child. which is in line with the United Nations Convention on the Rights of the Child. So are there any questions so far in regard to just that quick overview of our policies and policy principles? Okay. So I'm just going to go quickly through, I mean, what I'm doing initially is we'll be quickly going through your I guess, the responsibilities under the policies, just so that I guess everybody is clear about what our policies say, and if you've signed a contract with DFAT, what some of the obligations are under those policies. And then we will talk a bit more, I think, about how do we do this? How do we maintain and uphold these obligations in these times and during COVID-19 as well? So I've just put together three main responsibilities under your policy at the moment. First one is risk assessment and management. You need to assess the child protection and SEAH risks of your organisation and your activities for all of your activities. And then you need to apply the appropriate minimum standards to manage that risk. You need to monitor your downstream partners for compliance with both policies. And it's your responsibility to make sure that your downstream partners are also child safe and are also have SEAH policies and processes in place if required. And then you need to report your concerns. They're the main things. And we'll talk about risk assessment, risk management and downstream partners first. We've got some questions which were about compliance with the policy, which we might just have a quick look at the moment. It was mentioned there needs to be full compliance for SEAH. This is contradictory for previous DFAT advice that there needs to be a plan working towards full compliance. Bronwyn, I think that might mean that maybe last time you spoke to DFAT, they were saying they may have mentioned that at that time you didn't need to be fully compliant, but you would have been expected to have a plan towards being fully compliant. We would be expecting that by the 10th of December that your downstream partners are fully compliant, and that, yeah, that you've probably already got a plan about how to do that, but we'd be expecting it to be done by the 10th of December. Okay, so it's possible that 1 or 2 months ago, I mean, maybe there was just the way it was presented made a little bit confusing, but people have talked a lot about it's expected that right then and there you should have a plan. Like if 2 months ago you didn't have a plan towards full compliance, then that would be a concern because there's quite a lot to do. But we can talk about that separately if you like, Bronwyn. We can give us maybe send an email to the SEAH reports mailbox, which you'll see at the end of the slide, and perhaps you can just talk to that team specifically about that. Okay, no worries, Bronwyn. Okay, and the other question was, can you describe how the SEAH and child protection policies relate to the environmental and social safeguards policy? That's a very good question. So they are all related. The difference being that they're related in that I'll start. The environmental and social safeguards policy is only an aid policy. It only covers the aid program, whereas child protection and SEAH policies cover the whole of DFAT. However, underneath your environmental and within your environmental and social safeguards policy, there's an expectation that you manage the risk of child protection and vulnerable people in general within that policy, and the policy links you to the child protection policy and the SEAH policy as ways of managing the risk to children and more vulnerable adults as well. However, part of the review that we're undertaking at the moment, one of the main questions that we're asking about that is how well are they connected? Are they well connected enough? And whether or not we need to actually and what can we do to perhaps streamline them all better, and make sure that they are linked together in a more structured and perhaps easier way for staff and partners to manage those policies. So they're related, we sit right next to each other, but yeah, the review should perhaps help with looking at whether or not improvements can be made in regard to that. Okay, I jumped in even though it wasn't a question time, but that's okay. We're going to talk about risk management now. So effective risk and issue management practices, they're directly related to achieving results and high performance, and it's fundamental to crisis management. So as the COVID-19 pandemic progresses, risks are changing, meaning that you need to have a sound understanding of your context and your operating environment and any red flags. So what do you need to do under the SEAH policy in regard to risk management? The first thing you need to do is you must assess the level of risk in every activity and contract that you have and apply the necessary minimum standards to manage that risk. So the question you need to ask is there a risk of SEAH occurring? If the answer is no, then you don't need to go any further. But there's very few contracts that we would have where there's going to be no risk of SEAH occurring. But there could be, such as a mobile phone contract, for example, might be one risk where you might say, well, there's no personal contact and it's all happening over the computer and nobody talks to anybody, so the risk is nil. But for all of our other contracts and activities, we're likely to have some level of risk. So then you need to determine the level of risk, whether it's low, medium, high, or very high. And you do this like any other risk by using your risk matrix to determine whether or not the likelihood and consequence of that risk and can help you with that overall risk rating. And then the level of the risk determines the appropriate minimum standards to put in place. There is a SEAH risk guidance note that can help you with assessing the level of risk. If everyone can get that, have a look at that now. We might have a quick look at that guidance note. If you have a quick look at attachment B of that risk guidance note, it has a number of risk factors there. And they're all sort of, it's attachment B table 6, right at the end of that risk guidance note. You'll notice that there's different types of risks. We've got sort of three types of risks within here. We've got business activity risks, then we've got organisational risks, and then we've got reputational risks. So in order to determine the level of risk, the SEAH risk of an activity, you need to think about the risks in those 3 different categories and how they overlap as well. So you might have a business activity risk, for example, that personnel are deployed to a remote location, which in itself will increase the risk of SEAH. And it does that because of both adults and children. It does that, we know that people being deployed internationally can increase the risk of SEAH because often they're away from their usual country place of residence, away from their family and spouse, for example. And in those cases, sometimes people may do things that they wouldn't, not normally do when they're at home, for example. So it just increases the risk. But if you add to this that activity supports people with disability, for example, then again, you're increasing your SEAH risk because you've got more people with greater vulnerabilities that you're working with. But then if you have a look at then organisational risks and you go, well, we've got an organisation that's got really strong policies and processes in place. We've got strong leadership on SEAH. We've got a really good gender balance in our organisation. Then that's sort of reducing your risk somewhat. You know that you've got those strong controls in place already. But then you have to look at reputational risk too. So if it's a very well-regarded activity, or you have a champion of that activity who is very well known and there's a lot of media interest, then you know that the reputational risk if something was to go wrong could be quite high. So you just need to weigh up all of those risks and make a decision about what level of risk that activity is. There are examples in the risk guidance note that give you some examples of low, medium, high and very high risk that you can use. It's not a tick box like the child protection one. You do need to do a little bit more thinking, I guess, in that regard, but that's sort of some of the ways you can use this guidance note. Then depending on your level of risk, that helps you determine what minimum standards you put in place. So you can see here, this is also in your risk guidance note as well, this table. You can see with this table that it tells you if it's any low or medium risk must have the first two minimum standards in place, or low risk must have the first two minimum standards in place. Medium risk must have the first three, high risk must have the first five, and then very high risk goes up to minimum standard 1 to 7 for very high risk activities. I'll just quickly go through child protection and then we can talk, I'll go through all the questions. So how do you assess, what's the expectation? This is currently in regard to child protection and risk management. Again, like SEAH, you must assess the child protection risk context of your organisation and all of your activities, DFAT funded activities, and apply the appropriate minimum standards that, that are required for that. Again, if you want to get out, there's the other risk guidance note, which is the establishing child protection risk guidance note. This can also help you with determining the level, the child protection risk context. There are 3 parts to this. One helps you determine whether the activity is working with children or contact with children. The next section looks at your organisation and whether or not it is child focused, and then also whether it's got strong or weak systems in place. And then that goes and gives you an overall child protection risk context level, basically. So you're either low, moderate, or high, very high. So you first have to find out the level of contact with children and then the organisation's risk. If it's high or very high risk, then you must do a full child protection risk assessment, looking at all the child protection risks within that activity, and apply or build on all of DFAT's 9 minimum standards. If it's contact with children, then you also need to assess the risk, and then using that risk assessment, apply the appropriate minimum child protection standards. And there are some minimum ones that I'll talk about in the next slide. If it's nil contact with children, and the organisation is not child focused, it'll be low risk, and you don't need to apply any of the minimum standards for that activity, but you're still required to report any concerns should they arise. These are the minimum standards. I'm not going to go through each of them in detail for this session, but I just wanted to list them. But you will see that we have got in our policy, we have said that if it's a contact with children position, we do expect that there's still safe recruitment and screening in place. We still expect that you manage the risk, that you do a risk assessment. We still expect there to be a reporting procedure in place. And we expect some child protection training, depending on the level of risk. So that we would expect that staff are at least sort of trained in their behaviour expectations and reporting processes, so that they understand how to report should anything occur. We have a bunch of guidance notes which can support you. a suite of guidance notes, and you can get them here. You can get them on DFAT's website as well. Two more slides just talking about a general overview of your obligations. You've also got an obligation to manage your downstream partners as well. Both policies apply to your downstream partners where there's links to DFAT. And you're responsible for ensuring that they are compliant. So DFAT staff are responsible, they need to make sure that their implementing partners have the policies and processes in place, and that they need to be assured that you have a plan and are doing a plan to ensure compliance of your downstream partners, but you need to be the ones that are looking at that and monitoring that compliance. And we may seek evidence of that as well, compliance. Okay, and then you've also got reporting obligations as well. So basically you've got mandatory and immediate reporting of any suspected or alleged child exploitation or abuse or SEAH incidents. For SEAH, it's 48 hours. For child abuse, we say immediately, but usually that, sometimes immediate is impossible. We do give sort of leeway, of course, for that. Okay, I'll answer some questions. Firstly, quickly, will these slides be shared? Yes, I should have answered that for you straight away. So hopefully you haven't been writing madly, Jessica. Zoe, I mentioned that downstream partners need SEAH and child protections policies in place if required. Could you clarify when it is required and if not? Sure, I'll go quickly back for you. If you have a look here for child protection, for example, you will see that for contact with children positions, there's not a requirement to have a policy in place. They can, and we do encourage it. We think it's good practice to do so. But if you're working with a partner and it's on an activity that is not working with children and only has contact with children, then they don't have to have a full policy in place. They don't have to have a full child protection policy. They just have to have reporting processes and safe recruitment and screening, some form of child protection training and risk assessments and processes. If I go back to SEAH, you'll see here, I know this slide's a little bit difficult sometimes to see, but you'll have a look. If you have a look at number 1, for SEAH is a bit different. For SEAH, they expect you to have a SEAH policy or other documented policies and procedures in place that clearly communicate expectations. So for SEAH, it's a little bit different. Unless it's a no SEAH risk, then they don't need to have a policy in place. So for SEAH, for example, it doesn't have to be a policy. It just needs to be some documented it could be, they could have all their information in their HR policy, for example, or in an ethics policy. They might, as long as they've got information in there is the main thing. And the so I'm just quickly having a look at, give me a second. Yeah, so it needs to basically incorporate, it needs to explicitly include preventing sexual exploitation, abuse and harassment, and include support for survivors, victims and whistleblowers as well in that policy. Isn't SEAH a risk for people working away from home, both for international and nationally deployed staff, i.e. staff working in an area they don't live within a country? Yes, absolutely. Yeah, so if you, I think the SEAH minimum standards, or the SEAH risk factors say, one of the risk factors is that the personnel is deployed away from their usual location or country of residence. So it's, so it's international or national staff as well. Okay, and policy non-compliance, sure. Policy, for examples of policy non-compliance are things like not getting the suitable recruitment and screening, people not recruiting and screening safely, so not getting criminal record checks or getting suitable referee checks and documenting them. Some other examples would be non-reporting as well. So even if, for example, something did occur in an organisation and they didn't report that would be considered policy non-compliance as well. So you'd have the actual report itself, which may be a child exploitation or abuse or SEAH report, but then you would also have a policy non-compliance. So it's when if you're not complying with those aspects of the policy. Training's not undertaken, for example, that sort of thing. And the next one is, I see the point about strong leadership involved in SEAH and agree this is important. However, there is limited involvement from the leader of the organisation, international and local, in the training and learning about the policy. What can you do better on this? I'm not sure I understand the question. Are we talking about DFAT organisation? Are you saying that there's limited involvement from leaders of an organisation in the training and learning? What I can say on this, I'm not quite sure what the question is, but I do, what we are doing as part of our review is looking at whether or not the policies, both the child protection and the SEAH policies, are as robust as they should be, for example, but also looking at things like the Royal Commission recommendations talked about involving communities more, but also involving in communities more in policy development, and also there's a lot of discussion about leadership and then the requirement to have leadership. And so our policies are both being reviewed with that in mind, and with all of the obligations and commitments that we've made in regard to SEAH as well, the international commitments, to see whether or not our policies and processes are actually hitting the mark in that regard. So hopefully that will, if there are any concerns about leadership, then that might then hopefully be discussed and thought about in that review. And you will have an opportunity to contribute to the review, which I'll talk about at the end as well. So if you do have comments or concerns about our policies, then you can absolutely take it to the independent review team to discuss as well. Great. Okay, we're going to talk about COVID-19 risks soon. So we'll talk about that shortly. And okay, survivor-centred approach. I'm sure I learnt that it meant if an adult survivor does not want to report, then their wishes must be prioritised, absolutely. In which case a staff person might inform or try to convince one to report or allow a report to be made, but the final decision rests with the survivor. Yes, okay, absolutely. We do talk about mandatory reporting, and we talk about mandatory reporting of any sexual exploitation, abuse and harassment, but it must be a survivor-centric approach. So we expect that it must be reported as per the wishes of the survivor. So if, for example, you have a SEAH allegation and we would like to know about them so we know that they're being managed appropriately. But if a survivor has said that they don't wish to report it, they don't wish to report it to DFAT, they don't wish to report it to the police, for example, then we need to listen to their wishes in that regard. But then we do have to be careful as well that that's that it's the survivor's wishes, not the wishes perhaps of the organisation involved as well. But yes, and we may, I know that there's sort of, that's not clear in the policy at the moment about that, and whether or not we, if there's if the survivor's okay with just saying something's happened and we're dealing with it, but not actually talk about details and that sort of thing as well. But yes, we are taking a survivor-centric approach, and it's with the survivor's wishes, as whatever the survivor's wishes are. Thank you. Okay, follow-up question on fraternisation and transactional sex in high-risk settings. Yes, for non-nationals. Okay, so let me just get to that point. I'm just going to go and have a look at that minimum standard there, just to clarify it. So these are two risks 6 and 7 are for very high minimum standard. 6 and 7 in the SEAH policy are only a requirement for very high risk activities. And so we're talking about activities where there's, exchange of, there might be, it might be sort of a protracted war crisis, or there may be a humanitarian response which is requiring exchange, aid and food aid and that sort of thing, where we know that there's a really increased risk of sexual exploitation, abuse and harassment. In those settings, we prohibit all personnel, so not just national and not just non-national, but all personnel from engaging from transactional sex when engaged in the direct delivery of DFAT's business. But we only prohibit fraternisation for all non-national personnel. So that means so any national personnel there, we're not prohibiting them from fraternising with their local people within their local community, for example. However, having said that, we do any relationship that appears to involve that involves preferential treatment or improper use of rank or position is something that I would hope would be forbidden for both non-national and national staff. But this is more about ensuring that our non-national staff are not forming relationships with local staff. Yes. Okay, great. So hopefully that covers that. Jade is going to start asking the questions, because we're going to do that anyway. Sorry about that, Jade. I took over that. Jade's going to start asking the questions so that while she's asking them, I can find the, if I need to locate any answers, I can do that while she's asking them. Thanks, Jade.
No problem, Tony. So we've just got a follow-up to that question on transactional sex. I was surprised that this was only prohibited for high-risk activities. Is there a reason it's not prohibited in other circumstances?
Thanks, Catherine. So it can be if your organisation wishes it to be. That's up to each organisation to determine the risk within their organisation. It was a decision made within DFAT, was that in some respects, there is an argument with transactional sex that that it could be a legitimate form of employment for some people, and is this something that we want to, I guess, be sort of saying that we I guess in a way don't want to be saying that it's not a legitimate form of business in some respects. So it was just a decision that was weighed up, I think, with within DFAT, that we would just focus on high risk, very high risk situations. But again, this is something that's going to be looked at within the review as well, because we made an undertaking to review this policy 1 year after implementing it, just because it was put out quite quickly. And so we understood that we might need to have some additional thinking of some of those aspects. And it's certainly, transactional sex and fraternisation is certainly an area where it's a little bit confusing for some people or not clear. So it's certainly an area that the review team are going to be focusing on as well. But yeah, it's up to an organisation to determine if they want to go above and beyond that.
Perfect. In terms of risk management, I've got a question here from Joshua and the categorisation of risk levels. What are the key determinants or factors that might differentiate high and very high in regards to SEAH?
Okay, so I guess if you can have a look at the guidance note, the SEAH guidance note, and it has got some examples. And one of the if you have a look at the example for very high risk, which is table 5, it's page 7 of the risk guidance note, the SEAH one. It's talking about a humanitarian response following, say, a category 5 cyclone, where you've got somebody actually in this instance, we're talking about a logistics advisor who is in charge of determining where goods go, for example, who gets that food and who gets that medicine. So we're talking about those sort of that is becomes a much higher risk. So there are some examples within that box there that you could have a look at. But then again, if you have a look at attachment B, which has the list of risks, you can see that you can see the business activity risks. You can see some high risk activities here, and it really is any disaster response, security and conflict or post-conflict or disaster setting, humanitarian responses. Those sort of responses and activities would be where we'd be seeing a very high risk. But having said that, you might find that you're working, you are working on an infrastructure activity as well. And we know that infrastructures projects are predominantly have a high male high number of male employees. If you've got that sort of project where you are in a remote place, for example, then you might think that's very high risk. So if you think about, there was in Uganda, there was a World Bank roads project where there was millions of dollars going into that, and it got halted and had to stop because so many young women and young girls, so many young women and girls were coming forward with allegations and high levels of pregnancies and STI and HIV from the workers that were working on that road. So again, construction sites can be very high risk as well.
Fantastic, thanks Tony. So we've got a question here from Christopher. Downstream partners often represent the highest risk the further downstream we go. How do you envisage requirements for small construction contractors and day labourers, for example? And I believe this question is in regards to SEAH as well.
Yes, well, we know our downstream partners, people's downstream partners, your downstream partners are at the most greatest risk. That's where we see the greatest number of notifications coming into our notification inbox. And we also often get these questions also with sort of from our staff as well, who are managing like small grants just to local communities and things like that. How do I envisage our requirements for small construction contractors and day labour, for example? I guess there's an expectation that we are engaging with people and that DFAT engages with people who are child safe and also have, are wanting to prevent sexual exploitation, abuse and harassment. So we get to choose who we partner with. And so I guess the same for our partners. We sort of say to you, well, you get to choose who you partner with, and we want you to ensure that you're choosing people who are as safe as possible in this regard and have processes in place that, I guess, make you feel confident that there are safeguards in place. In regards to small construction contractors, again, we're not saying that there has to be a specific preventing sexual exploitation, abuse and harassment policy, but we would expect that they'd have some form of, that there would be aspects within maybe their HR policies or their agreements even that acknowledge the issue and their commitment to be safe. So how that looks, I guess that's dependent on the situation. And I know it can be difficult if you're just engaging someone who's a two-person team, for example. What does that look like? Maybe instead there needs to be, need to be thought that when you're doing your risk assessments, you need to think about ways of managing that risk, and whether it is putting in place codes of conduct or asking them if there's just a two-person team to sign on to agree and sign on to your policy at that time as well is another option that you could look at. Noting that if you do have people signing on to your policy, that means you're responsible for the risk. That means you're responsible to do their training, you're responsible to manage their notifications, and you're responsible to make sure they're recruited safely if you are recruiting people. So you're taking on that extra risk if they sign on to your policy. It's just something to think about. But yeah, it's a good question, not one I can answer quickly here. It's just, I guess it's all about doing a risk assessment, managing the risk as it comes up.
Perfect. We've got 2 questions left. So to the person who's asked the question about online delivery during COVID, we will talk a little bit more about COVID in a moment. So we haven't forgotten about your question. The final one for this section, Tony, is there a reason that the tick box process was not used, similar to the child protection policy? Would you see an issue in setting up such a process to facilitate risk assessment? I'm assuming that means in the SEAH context.
Mm-hmm.
And if we're looking at streamlining policies, is there scope to combine risk assessments as some of these areas are similar?
Thanks, Karine. I have no issue with you combining your risk assessments at all. It doesn't matter if, as long as you're thinking about risk, as long as you're sitting down and thinking about child protection and SEAH risk, then you can combine it. You don't have to have a separate child protection one and a separate SEAH one, and you can add them together in your risk register. However it works for you, as long as you're thinking about it and managing it, is all that's really important. There was a lot of toing and froing about the tick box process, and it was decided that because there's so many different, with children, it's a little bit easier because you're not all your projects are going to be about children. So you can kind of have some sort of questions to try and determine whether or not it's working with, whether or not it's contact. With most of the activities that you guys are going to be dealing with, it's all going to involve people. And if it involves people, it involves risk. And so it's just a bit more difficult it was a bit more difficult to figure out what questions can we use to determine whether it's whether something's high risk or low risk. It's more contextual, and it requires you to think about, well, yes, there's a risk, but that risk is quite low because of X, Y, Z. We've got strong systems. People, there's not that much interaction. Whereas in a different scenario, that we know that there's a lot of interaction, and we know that our organisation has 90% men, or we know that our organisation, we know our organisation, for example, employs a lot of transgender people. So we've got, we just can't figure out, we couldn't work out all the questions that you have to tick to be able to determine that. But having said that, there's no reason why you can't make your own tick box. There's no reason why you can't have a look at what we've got here and go, well, actually, I think for our organisation, we know some of those, the answers to some of the questions that I just said. So we can actually do our own tick box. We've got no problem with you doing that. But again, talk to the review team if you want to talk about that, because it's certainly a lot of similar feedback that we're getting from a lot of people, Corinne, about that tick box process. Melanie, we're not reviewing requirements for fraternisation and transactional sex as such. When we say, I mean that we're doing a full review, and that will be considered as part of the review. So we were always doing a full review 1 year after. Sorry, I didn't get you to ask the question. We were always doing a review 1 year after the policy was in place. And transactional sex and fraternisation is going to be part of that. And when I focus on that, it's because I know that a lot of people have had questions and queries about that. So I know it's going to be an area that perhaps we need to clarify a little bit more for people. But yes, so that's where that's coming from. And I hear that you're saying it's a nearly impossible scenario and causing quite a lot of stress and consternation for our partners. Okay, so I guess, Melanie, if there's, maybe there needs to be some clarification about it. Maybe if you could, I'm not sure in what way it's causing stress. Is it for your non-national staff that it's causing stress and worry? I think maybe this is something that perhaps we need to talk through more about the SEAH team. I might need to talk to Kath a little bit more about that, who sort of manages a lot of the SEAH side of things, and have a bit more of a discussion about that, if you like, offline, Melanie, because I'm not sure what we might need to go into a bit more detail about what the concerns are as well. And Jodie Kelly?
Yes, question from Jodie. I was sure that we were given an extension, and I was told it was on the DFAT website.
I'm not aware of the extension, Jodie. So maybe if you could contact, we'll write that down, and I'll confirm with Kath and Sonia, my manager, but I'd have to, we can have a quick look on the DFAT website as well, but it doesn't, I don't believe an extension was given. Okay. But again, I'll take that up with Sonia as well. The extension was due to COVID. Might have misheard. Okay, well, let me take that back, and if there was an extension given, we'll make sure that everybody here on the call is aware of that, and also that it's on the website, because I had a look at the website today and it wasn't on there. So thanks, Jodie. We'll follow that up. Okay. Might just carry on. We've got one more question about fraternisation. So wouldn't fraternisation fall within the broader definition of sexual exploitation, enforcing an absolute? Yeah, look, when we talk about fraternisation, so we're talking about our guidance note sort of outlines it a little bit more and talks a bit more about, so down the bottom it says, it's any relationship that involves or appears to involve partial preferential treatment or improper use of rank or position, including but not limited to voluntary sexual activity, including sexual behaviour not amounting to intercourse, a close or emotional relationship involving public displays of affection or private intimacy, and the public expression of intimate relations. I think the strong part here, isn't it, is that it's any relationship that involves or appears to involve partiality, preferential treatment, or improper use of rank or position. So I think we need to be kind of I think that that's an aspect there that perhaps can clarify things a little bit. It's not that we're saying you can't have a friendship at all with someone within that country, but it's more, it can't be a relationship that appears to involve preferential treatment. Now, we might, again, if there are more questions about that, please send them to the email and we can make sure it's clarified. And I can also post after this some, you know, something that really, if what I've been saying, if this is not on the mark, then I'll make sure that everybody's clear about that too. Okay, so risk management during COVID. So we've seen before in previous public health emergencies that the risk of SEAH for children, both children and adult, increases, and the same is the case with COVID. The surge of new responders, for example, combined with high demand and unequal supply of food and health supplies also increases that risk as well. So child and adult safeguards has never been more important or more challenging than it is at this moment. We acknowledge that. And COVID will continue to have, we expect that COVID will continue to have a substantial impact on how we do business. There'll be changes to resources, travel restrictions, staff, where they're working, physical distancing requirements will significantly impact how you manage your programs and your partners. And it's also more difficult for you to monitor what is happening on the ground. So we acknowledge this. But we also know that SEAH risks have increased, as everybody knows. You'd only have to do a quick Google search to see that globally women and girls are disproportionately affected by abuse during COVID-19. Family violence and online abuse of children rates have increased. And people with disabilities, sexual and gender minorities and boys are also at increased risk as well. We know that sort of isolation and school closures can result in less supervision, and increased exposure to the internet will increase the risks of sexual exploitation, grooming and harm. We also know that girls can face an increased burden of unpaid care and housework for families that have a loss of income or illness. I mean, they're also at greater risk of early marriage and they're less likely to return to school after school closures as well. For risks to adults, we know that it can increase the risk of violence against women and children in the home. And with limited access to resources, there's an increased risk, of course, of sexual exploitation in order to get those resources. So, but COVID-19 doesn't change DFAT's expectations under the policy, and as we can see, it's important that these policies are thought about, even that there's more, I guess, more thought about these policies than there was before. So what does this mean, and how can we do this well during the pandemic and during COVID? I'm really interested to hear from everybody here about what they're doing and what they're doing well. It's been really helpful for us to hear that. But what I'm going to do is and luckily there's actually a lot of literature out there at the moment as well about how to do, good ways of monitoring remotely, and also ways of managing the risk of SEAH and child protection during COVID. So there's some really good resources, and I'll send you to some of those at the end of the session as well. So I'll give you some ideas, but I'm really interested to hear from you what your ideas are too. So firstly, you need to continue your safeguarding standards, like I said. So you must really ensure that staff that you're engaging are still being vetted appropriately, and volunteers as well. So it's important that these are still being done. And that, I guess, you as your managing, the implementing partners are continuing to check that this is being done as well. So other things that you can do, which just can help, is just to circulate your current policies and processes, so people remember that they're important, and sort of tell people to talk to people about why they're even more important at the moment. Continue your regular training for staff, and to continue your regular risk meetings as well. Clear communications really need to be provided to staff to ensure they continue to prioritise SEAH and child protection policy requirements and managing the risk of those at this time. Have you got any questions?
We do. We've got a question that related to COVID-19 and some of the risks of online delivery, and some examples of how to manage or mitigate those risks.
Okay, so that's a good question. I'm wondering, I've mentioned those risks, but I don't have personally here on this slide, in this presentation, I haven't provided a whole sort of number of ways to mitigate that risk specifically. However, we do talk a little bit about shortly about ways in general to mitigate risk. So I hope that might actually assist you. But we know there are increased risks. We've got, and so in a lot of cases, it's about ensuring that you've got good, strong codes of conduct about how if you're going to online delivery, and if you're going to sort of more online consultation and connection with community, just to make sure that your staff and your downstream staff have very clear guidelines about what's okay behaviour and what's not. Because we know that in a lot of cases, if it's a working with children activity, we say previously, before COVID, it was like, we don't recommend you have personal social media accounts with your beneficiaries, for example, because that's makes it a bit more easy for people to connect without other people being able to oversee that, and then possible harm could be could happen. Sometimes in these situations, people are saying, well, this is the only way we can connect, is if we're using social media. So it's trying to make sure that perhaps codes of conduct are updated and people have really clear guidelines about what's okay and what's not okay. But there's also issues, I think, about data confidentiality and that sort of thing as well. So I'm not going to go into those in detail because I don't have the expertise in what data sort of platforms are the best to use, or that sort of thing, but it is something to consider in that regard. But I'm going to keep your question up there because just to flag it, so that when we keep going on through the rest of the slides, I can see whether or not we've satisfactorily answered that. Okay.
Okay, and we've got quite a long one here. So while it is very likely that safeguarding risks in a community are increased during the pandemic, while community members are being encouraged to stay home, upon our request for information around changes to partner safeguarding measures in the context of lockdowns, some in-country partner raised their perception of a distinction between latent safeguarding risks in communities compared with risks generated by the project itself. If there is a hypothetical safeguarding incident in the community that is occurring during lockdown at a time when no project staff are able to actively work in the community, is that something that the project team should be seeking to know about and report through remote monitoring channels?
I personally think that we need to do everything possible to open up reporting channels for people, and that in this situation at the moment, actually just having a number to call might not be enough in order to get people to actually be reporting. That we need to be somehow finding a way of getting out there, but then we have to make sure that's a safe way of doing it, for not just for everybody, to actually try to find those incidents of sexual exploitation and abuse, rather than waiting for people to come to yourselves and that sort of thing. So I think, I think that if you know that there's a safeguard incident happening in the community, and but it's not linked to your program, then I'd be certainly hoping that there'd be, I guess that you or your organisation would be looking at ways to support the victim survivor of that, or the alleged victim survivor of that safeguarding incident, and finding ways of actually connecting that person to some sort of form of support. How that's done, I don't know. That's a very sort of hypothetical question, but I mean, if it's not a DFAT funded activity, there's no expectation under your contract that you do it, but there's still, I would say, as a way of building trust in the community and supporting your affected community, the affected communities that you're working in, that you would try and endeavour to do your best to support that person.
Fantastic. And we've got a question come through from Joshua. Under the guidance note, it refers to organisational activity and reputational risk as considerations to take into account when assigning a risk level of a program or partner. In order to evaluate the true risk, environment, context, and taking a victim-centric approach, does it not make sense to focus purely on the activity and proportional risk treatments, regardless of whether organisations may have good systems and processes to mitigate CP and SEAH risk and the reputational effects an incident may have?
Josh, yes, I kind of agree with you, Joshua. Yes, and if you have a look at the, but I realise that the guidance note doesn't necessarily, it is a little bit, I see where you're coming from, and that's certainly what we do for, we kind of do that in some respects in the child protection policy, in the child protection risk guidance note, because regardless of the organisational, the strength of the organisation system, if it's a working with children activity or if it's a child-focused organisation, it's automatically high risk. Nothing you can do in the organisation is going to change that. And I think with the SEAH, the SEAH guidance note, because it's not got that sort of that sort of tick box which makes it really clear, it does give you the opportunity that in the guidance note that if your organisational risk is really good, then that will then reduce your overall risk, because it's even if you've got a high activity risk, if your organisational risk is really good, that can reduce your overall risk. And in some respects it does, because you know then that there's, I guess if something does go wrong, you've got all these systems in place to help manage it, but also hopefully you've got all these systems in place to prevent it. So it's automatic, it is going to assist in reducing that risk. So I see where you're coming from, and I kind of, I see your side and I also see the side of the guidance note. I get both of them. So in answer to that, I would say to you, Josh, is that look at this guidance note, and if you think that it's really important for your organisation to have that, to take only into account the activity risk when you're assessing your risks of your activities, then please do so. And please go back to the review team if you think that that's an issue, and ask to speak to them, and then you can mention that to the review team, and they can consider that in their review as well.
Thanks, Joshua. We've got a question here from Zoe, which I'll ask in two parts to give you a chance to answer the first bit first, Tony. We have been working to support partners to develop meaningful policies and processes to reduce the risk of SEAH. However, COVID obviously impacts our ability to do face-to-face training with partners, as well as impacting partners' ability to do consultation with communities, especially vulnerable people. Rushing the process to be compliant, despite being unable to do these things as planned, increases the risk that developed policies and processes are done as a tick box exercise, limiting their value and how useful they are for actually serving the purpose of reducing risks in communities. has this been a discussion point by DFAT, considering the possibility for extension of the compliance deadline for downstream partners? Is the first part. Would you like to answer that first?
I'm going to answer. I've actually read part to the next bit. Do you want to ask the next question?
Yeah, of course. Do you have any suggestions for developing meaningful policies and processes despite limited ability for consultations, monitoring of developed processes, etc.?
Okay. Thanks, Jade, and thank you, Zoe. I think you've got a really good point, Zoe, and I think it's something that Jade and I will both take back to Sonia, our manager, about this and talk about it. I mean, I think the concern is from, I haven't personally talked to them, but I'm because my focus is mostly child protection, but I know that CAF would have, and there'd probably been some discussion. My understanding is that people I think DFAT is concerned about the fact that the increase of SEAH and child protection is just increasing quite dramatically. And then if that's increasing and then we're actually stopping, we're not sort of still pushing through to get our downstream partner processes and practices in place, that maybe that's sort of, really we should be pushing to get these policies and practices embedded as soon as possible because of the increased risk. So I think that's where they're coming from. I will take it to them again and say, is there any opportunities for extensions in this regard? But I believe that is why the push is that there hasn't been a decision to extend it. That's my understanding. Do we have suggestions for developing meaningful policies and processes despite limited ability for consultation? I guess my next slides are going to talk a bit about that, but I talk about suggestions of still doing things well during these times. And I think a lot of it requires finding other ways to connect, I guess, which you all would have done, and you all be doing, Zoom or however it is that you've chosen to work with teams now, and whether or not it's just ramping those up, or I guess building on what you're already doing in a way. So let's go through the rest of my slides and see if that answers it. If it doesn't, we'll come back to you, Zoe. Yes, and Zoe, I agree, rushing the process doesn't necessarily serve to reduce the risk, but we'll talk about that. And I guess, it's been happening since April, hasn't it? So it's I could say this is something that we're hoping would have been in train from last year, but I acknowledge that COVID's really done a number. So we'll take it back to Sonia and see what she comes back with, and I'll confirm it to all the team, all the group here as well, whatever answer I get. We better carry on because I've got a few slides to get through, not many, but I'd still like to do some more discussion. Oh, what I was going to say here is, in order to, when we're talking about safeguards and implementing safeguards as well, and ensuring that we continue to ensure that our downstream partners do their recruitment and screening and all those, implement those minimum standards, a lot of DFAT staff use a simple Excel spreadsheet. You guys are probably already all over this sort of stuff and have in place things where you're managing your downstream partners, but there is an Excel spreadsheet that they use, which I'm happy to attach, but it basically just has, and it's not all staff, it's just a select few who choose to do this, but they do a sort of six monthly check where they actually go to their implementing partner and say, they've got a spreadsheet that talks about the investment, the level of contact, and whether they've got a completed establishing child protection risk guidance note. And then they ask questions every 6 months. When was the last child protection training done? Can you provide us with training logs? Can we get some, proof that you've done safe recruitment and screening? Can we see some codes of conduct? And just does this, you know, they've got a standard email they send out every 6 months or so. I'm not sure it's 6 months, but just to kind of keep people on track and make sure people are still doing those checks. It's just a way, it's just one tool that they use, and I thought I could share it with you if you're interested as well. So what can you do? Obviously, identify new risks. You need to, I guess, ways of trying to do this well during, continue to do safeguarding well during COVID would be to take the time to review and update your risk registers and to include any specific risks in relation to COVID. What are those increased risks? And that would include, you know, your cyber risks as well. Think about who's most at risk in your particular context, for example. What are the risk factors within each of your activities? Where are the biggest differences in power, for example, where goods and cash are being distributed, where workforce is primarily male, for example, as these will increase the likelihood of SEAH happening. Those working in industries such as health and education and humanitarian settings should pay particular attention to the changing context and the change to online activities being more commonplace as well. And partners are also encouraged to consider the risks associated with remote program delivery, such as cyber and data security risks, a lack of being able to identify wrongdoing, lack of survivor support, and difficulties in doing investigations during lockdown and that sort of thing as well. So I guess the first thing is to really identify what those new risks are, because without identifying them, we're not going to be able to, you won't be, obviously be able to manage that risk. Reporting mechanisms. It's still a requirement under both policies that you report any incidences. We're really there's been a significant reduction in reports to DFAT. And when you think about the number of we know that child exploitation abuse is increasing, but our reports have gone down. There's obviously many different reasons, possible reasons for that. One being there's less face-to-face contact between staff and beneficiaries, so less likely to have perhaps SEAH or child exploitation abuse or SEAH from happening. But it also could mean that reports aren't coming back to us. So the use of like isolation methods, so the use of lockdowns and that sort of thing can limit access to information about sexual exploitation, abuse and harassment. And it can also reduce the access of survivors to reporting channels and services. So yeah, we need to ensure that what you have in place works now and is robust and accessible to those within the community and within your organisation. Because pathways to reporting are critical. We know that in all of the big stories that come out about SEAH issues, pathways to reporting are critical and must be effective. Obviously, strengthen your existing channels or change them if you need to. Report and adapt, review and adapt your reporting mechanisms to make sure they're accessible. Ask the community. One of the main points that came out of the ACFID safeguarding panel discussion was the need to include communities in safeguarding efforts. And I think maybe we have an opportunity during the pandemic to do more of that as well, and to because a lot of the discussion, well, some of the discussion in that panel discussion was that a lot of the safeguarding work is donor driven and not community led, and so there's little opportunity for communities and partners to talk about what they want or how they want safeguarding to look. And often it becomes a bit of a tick box, yeah. So there was a lot of discussion about that. And it was centred around if the community doesn't have ownership of safeguarding messages, then they won't work or won't work as well. And that we really need to consider their views, which is something obviously we would hope would happen, but it's when you do have a lot of those sort of compliance mechanisms from donors, sometimes it can become more of a tick box. So maybe it's an opportunity now to engage more with your communities, to ask them what they need and what would work best. And I guess really you're going to have to do that in some respects because you're not there to do it. So you need to be focused on working much more strongly with your in-country partners. And affected communities, in particular women and girls, should really be consulted about their preferred options for complaints mechanisms as well. Okay, I'm not going to spend too long on these now. We're just investigations and responses. You know, they still must be, it's a difficult time, but there's still an expectation that they're undertaken by experienced and qualified investigators or professionals, just because we don't want to increase the harm on a child or adult. One of the things that people have talked about would be really useful is to try and get an updated list of referral services. So, for example, the question that we had before about what happens if there's an possible incident in the community. If we've got really good up-to-date list of referral services that are still working and still supporting survivors, then that can go somewhere to help. And if we can make sure that your people in country, as well as your any beneficiaries, have access to that too. And the victim survivor centred approach is very important and something that we want to of significant importance during this time as well. One thing I wanted to talk about, which I don't think I mentioned, was a really good example, which that came out of one of the I think it was the round table that happened recently, which was about Oxfam. Thank you. At the Oxfam provided a really great example of a way of helping to identify instances of SEAH. So they talked about in Timor-Leste, the staff knew that they needed to improve community feedback mechanisms because they were too reliant on feedback from communities to Oxfam coming via partners. They needed a way for communities to raise concerns and give feedback directly to Oxfam. So they designed a very simple feedback box, a very lightweight, waterproof sealed box with a lock that contained paper, pro forma forms and pens, markers, and it made the kit completely self-resourced and very mobile, and they'd take it around on their motorbikes and stuff. It got carried around to all Oxfam activities, and the information on the outside of the box included phone numbers people can call for safeguarding or general feedback if they prefer to raise concerns via phone. It had that information. And it was, I think it was I haven't actually written down, I think it's called the Speak Up box, because that's how they talk about safeguarding. They say speak up. And they distributed that to all their partners, and they have boxes in 2 Oxfam locations as well. So it's just a way of getting feedback and identifying instances of SEAH and talking to local, local partners to sort of think about different ideas and ways to get that sort of feedback. So I'm just going to quickly, because I know that we're nearly running out of time. So ways of ensuring that we identify instances of SEAH is basically training staff, continuing that training of staff, reminding staff about identifying how they can identify and respond to SEAH and child protection. Communication and trust. It's really important the communication trusts that if they do report, something's going to be done. So actually following through with reports as well, and telling the community what behaviours, the behaviour expected of aid workers at the time as well. Transparency, again, your partners need to feel comfortable to disclose. You need to build a culture of trust with your partner organisation, so they're disclosing to you, so then you can make sure that any incidents are being satisfactorily managed. And again, this is the story about Oxfam. It's like, talk to your in-country staff, obviously, and see if they've got any examples or ideas of ways to improve the identification of SEAH. Okay. Some other suggested measures quickly. Disseminate key SEAH messages to communities. This is a really great guidance note, which I recommend you have a look at, which helps you with giving you information on how to communicate safeguarding. And also designating a focal point, strengthening female leadership and participation, and just coordinating generally with other agencies as much as possible, as well as some other ideas. There is a really great safeguarding resource and support hub. I don't know if everybody knows about this, but if you don't, this is an excellent resource that I recommend people go to. It's open access and just brings together quality assured information for you. All right, before we go on, we've got a few minutes. I'll answer another question.
Looks like we've currently only got one here in front of us.
Mm-hmm.
Would the completion of the ACFID introduction to safeguarding course by downstream partner staff who speak English be considered sufficient compliance? Sorry.
Yeah.
At least in this difficult time for face-to-face training. I also note that partners in Nepal will be working with DFAT post-translate.
Look, when we talk about training, look, I think that's would be great to do, and I think absolutely go ahead. But I think what's really important with training is that people understand how to report within their own organisation. So not only doing that, but actually doing training for specific policies and processes within that organisation, I think is the biggest, is really, really important. So yes and no, but it doesn't require you to do like a major training, just, half an hour talking them through your expectations, and also codes of conduct. You might have a specific code of conduct for that organisation, that activity. It's really important that you're giving them information specifically about their activity. I'm just going to quickly go, overview. These are our main points, really. Know your context and risk, show leadership, reporting is mandatory. I don't want you to miss out on knowing how to do a review. So I'm just going to put that up now. If you wish to provide feedback to the review to any of our safeguard policies, that's the child protection, preventing sexual exploitation, abuse and policy, or the environmental and social safeguards policy. The 3 policies are being reviewed at the moment. You can write to Strategic Development Group, who are doing our review, and they will get in contact with you. So please do it. It'll be really useful I'd do it sooner rather than later. Just get in contact. Just send them your details and they will contact you either to speak to you or send you a survey of some sort. Time frame to evaluation. Oh, sorry. I think
That's okay. It's a leading question, so you can.
Look, it's been pushed out due to COVID and all of that side of things. So we have had to extend it. But I'm truly hoping, fingers crossed, that the review is complete by early next year. But I'm not promising anything. Great. In regard to the online delivery, I might just write a point down for that, risks in online delivery that we may not have covered exactly. There might be a guidance note somewhere, I believe. I did see one. I will attach it to all the information that we provide to you. If I can find that guidance note that could help you regarding managing the risks of online delivery, I will attach it for you. So these are our contacts, which we will send to you, and please contact us with any questions or queries or anything that you weren't able to talk about today. We're really happy to discuss those with you and to answer any questions that you might have. But thank you very much for your engagement and time. I think it's and we're really keen to hear from you if you've got any really great things that you've been doing to manage risk during this time. And I don't think there's any others, is there? I will share the spreadsheet. I'll share all the tools that I've talked about and try and get back to you on all the questions that you've asked as well.
Fantastic. That brings us to the end of the webinar, everyone. Thank you, Tony. Thank you, Jade, so much for your presentation. Everybody, we will be in contact with a follow-up for this webinar where we will share the link to the recording, the slide deck. We'll also be passing the registration list to DFAT so that they can respond to any outstanding questions and share the resources that were mentioned. In the meantime, there is the e-learning that's available on Learn with ACFID. There is child protection e-learning and also the introduction to safeguarding. If you are an ACFID member and you would like your staff or the staff of your partners to access that e-learning, you can contact the learning team here at ACFID. We are learning@acfid.asn.au and we can set you up with direct access to that e-learning if it is of interest or of help. Also keep an eye on our events page for upcoming webinars and online events. But for now, we'll say goodbye, have a lovely afternoon, and hopefully we'll see you again soon.